Good morning. My name's Rachel and I'm going to be going over an instructional video on how to insert a Foley catheter into a female patient. That's what I'll demonstrate today. So you're going to want to gather some supplies before you go in, but first you're going to verify that the patient actually has an order for a Foley catheter, and then when you go into the room, you'll verify it's the right patient and all that. So some supplies you want to gather is a Foley catheter kit, but you want to make sure you have all of your supplies in the kit. So this would include sterile gloves that fit you, a sterile drape, the cleansing solution, lubricant, the Foley catheter itself, sterile water for inserting into the balloon, a syringe, your collection bag, and then like cotton or cleaning swabs. So once you have all your supplies, you're going to go into the patient's room. You're going to practice hand hygiene when you walk in. You're going to make sure the patient's comfortable, or they don't need anything before you get started, and make sure they're not going to be in too much pain. If they'll tolerate it, you want them lying supine to make it easier for you and the patient to insert the Foley catheter. You're going to check 2 patient identifiers and make sure that you have the right patient. And again, check and make sure that you have an order for a Foley catheter. After you have all your supplies and you've checked that it's the right patient and there's an order, you're going to go ahead and explain to the patient what you're going to be doing. And you want to do this in layman's terms. So usually I say I'm going to be inserting a tube into your bladder. That will help your bladder drain so that we don't have to get you up out of bed or put you on a bedpan or something that's going to be too difficult for you as the patient, or put you at risk for hurting yourself. So, and then obviously if a patient is not conscious, it might even still be a good idea to explain to them what you're going to do, just in case they can hear and are aware of what's going on. We just don't know they are. So you've gathered your equipment, you've explained to the patient what's going to be going on. You're going to assist them to a supine position and usually have them spread their legs like a frog and put their feet together if they can tolerate it. Obviously, if someone has some sort of pre-existing condition, they can, or they're here for like a hip fracture, you don't want to be making them go into uncomfortable positions. So you're going to open your kit that you have, or usually it comes in a kit because it's all sterile. So you're going to open your kit, observe and make sure everything's in there without touching anything. You're going to prepare your sterile field. Again, explain to the patient that this is a sterile procedure and that everything's super clean. And so we have a very methodical method to get this catheter inserted. So after you apply your sterile field, you can apply your sterile gloves and make sure that it's the right size. So if you don't know what size you're using, I would check ahead of time and make sure that the gloves that you picked fit before you get in there with the patient. And I sometimes grab an extra set of sterile gloves as well, in case you break them, or in case you break your sterile, another sterile field, you don't have to go back out and get new gloves. So you're going to apply your gloves, you're going to get your kit prepared, so make sure all of your supplies are in there. You can, when you have your sterile gloves on, you can't put them below your waist, so have everything in front of you and make sure that the patient's set up so that you don't have to move anything. It would also be a really good idea to have an extra person in there that doesn't have sterile gloves on, so in case you forgot something or need to reposition a patient or just need an extra set of hands, you have it in there. So you're going to take the lubricant out of the packet, and usually you can just empty it into the tray and put the distal end of the actual Foley catheter into the lubricant so that it's ready to go. I would even go as far as opening all of my swabs if they're within that sterile field. If they're not in the sterile field, I would open them and set them so that they're ready to go, and then have someone hold them and hand them to you so that you can grab them without breaking your sterile field. So you're going to get the Foley catheter ready and you're going to put it in the lubricant. You're going to, before you even do anything, assess the like vaginal area of the patient and make sure that there's no like signs, no like lesions or bed sores that you can notice, or the patient's not soiled. You want to clean them before you're applying or inserting a Foley catheter. So if they're dirty, definitely make sure that you clean them up prior to inserting the catheter, because we want to decrease all risks of infections when inserting this Foley catheter. So after you apply your sterile drape, if you have everything set up and you have an extra person there and you don't anticipate that you're going to need to grab anything more sterile with more than one hand, then you can take your non-dominant hand, which would be my left hand, and you're going to separate the labia of the patient. And once you do that, that hand is no longer sterile. So you can't be touching anything within the sterile field or grabbing anything out of your kit. So once you spread the labia, you want to get your cleaning. Sometimes they're swabs, sometimes they're forceps with little cotton balls with a like betadine solution, and you want to, while separate the labia, you want to clean like anterior to posterior with the patient, and you want to clean from the inside to the outside to not bring any bacteria in. And usually it's like one swipe per swab or one swipe per cotton ball, because we don't want to cross-contaminate our already sterile field. So you're going to separate the labia, and you're going to clean with your cotton swabs or your regular swabs, and make sure it's from front to back. And then you're going to start at the inside and work your way out. This is for the female patient. Male patients are a little bit different. And then once you are done, you can toss your swabs just out of the way, because you don't want them getting within your sterile field once you've done that. You're going to take your sterile hand, and you're going to reach down and grab the distal end of the catheter that's in the lubricant, and kind of, if you can, coil it in your hand or have it coiled prior to cleaning the patient. That way it's easier to grab. So anyways, you're going to grab the end of your Foley catheter, and you're going to, while spreading the labia, attempt to find the urinary meatus. And once you find the urethra, then you can insert the Foley catheter. You don't want to be like going in blind. If you can't see the urethra, then don't proceed or have somebody come and see if they can see it. So once you find the urethra, you're going to gently insert the end of the Foley catheter into the urethra, and make sure that there's lubricant on there before you just go sticking something up there with your sterile hand. And you're going to gently feed it. Obviously, if you hit resistance, don't push too hard or too fast. I mean, just gently see if you can maneuver the tube or the catheter to get it to pass if it's not passing. So once you're going to insert with your sterile hand, and once you see urine draining into your bag, then you can only advance about another inch or two, just to make sure that the end of the catheter is in the bladder. So once you have that done, you're going to hold and make sure you can take your non-sterile hand and grab below the urethra, and touch anything that's not going to be going into the urethra. So if you're done advancing, you can grab below and just hold it secure there while you insert the syringe into the catheter, or you can insert the syringe before you break your sterile field and get it secured. That way it's there. But you're gonna, inside that syringe, there's usually pre-filled saline solution, or it's usually about 10 cc's. It's whatever is your hospital policy or what's in their kits that they have. But you're gonna insert that saline into the balloon that's inside the bladder, and that's what's gonna secure the Foley catheter from coming out of the patient's bladder. So once that's in the balloons, you press the fluid into the balloon, and then you're going to disconnect that syringe so that it doesn't drain out. At that point, your sterile field you don't need it anymore. As long as nothing is advancing into the urethra or bladder anymore, you don't have to worry about your sterile field. So at this point, you want to, there's usually a sticker that attaches to lock the catheter in place on the patient's like anterior thigh and or medial thigh. So you want to attach the catheter tubing to that like little locking sticker to make sure that it doesn't, number one, like just get pulled out of place. It's like an extra protection, and then it kind of just keeps it out of the way if like the patient were to have a bowel movement or something. That catheter tubing is out of the way and shouldn't get stuck underneath them in bed and things like that. So once you get that stuck to the patient's leg and it's secured, then you can evaluate your tubing and make sure like nothing's clamped or anything, and make sure that the urinary like drainage bag is below the level of the patient and not in any knots. and not on something that like moves on the gurney or the bed. So if you put it somewhere, make sure that like if somebody drops the side rails down, it's not going to yank on that tubing and pull the catheter out of the patient or disconnect it or anything like that. So keep that bag below the bladder, and you can at this point start observing the color and the amount of urine that's in there. And if you need to take a urine sample, this would be a good time to do that. And then you can just take your gloves off, and you want to document that you put everything in there, so that you want the size of the catheter that you used, like the patient's response to the procedure, if they tolerated it well or didn't, the amount of water you put in the balloon sometimes, and then like assess their urine output and say, you know, if the urine was clear or cloudy, or if it was yellow or red, or whatever you observe. And then you will just make sure that you continue to check the patient's urinary output, and that it's not, the bag's always below the level of the patient. And then when you have an order to remove it, you can remove it, and that will be a video for another time. So I hope that video was helpful. Just making sure you gather all your supplies and have everything ready before you go in there, and grabbing an extra hand can make a difference. That way you're not wasting a whole kit or having to run out and grab somebody. You have everything that you need in the room with you. So it makes it less painful for you and for the patient. Thanks.